Start.
Are we just waiting for the Zoom, or?
I started already. Connect.
Just wait for a few more people to connect. Can we just see the participants?
Yeah.
Okay, guys, just a few more minutes. We're just waiting for a few more people to join us, so just a few more minutes. Okay, welcome to the webinar. Today we'll be talking about remote care and tele-monitoring, and obviously we're from the Health Bank. So thank you everybody for joining us. I think most people have joined now, but everybody's welcome. So just to introduce myself and my colleague Reem. So I'm the Clinical Operations Manager for THB Home Care, which is part of the Health Bank. So I've been a registered nurse now for, well, it feels like an eternity, but around 15 years. And I've been in the Middle East for most of that time as well. So my passion comes from caring for people, particularly in the community after transferring back from particularly long hospital stays. And my colleague Reem will be assisting when we show you some of the devices that we have later on in the webinar. If any of you have any questions or anything, type away. We'll try and answer them. We can't do it interactively, but we'll have a look at them towards the end of the webinar, and then we can answer any questions that you might have. Otherwise, you can always drop us an email or get in touch, and then we can try and assist you with any questions that you might have. So the Health Bank, who are we? So the Health Bank, we're a global healthcare management company. We have many verticals, starting with wellness programs, health management, health concierge, and our home care services as well. We also do health management, where we have a dedicated manager that would be appointed to a client, and their role is to schedule appointments, offer reminders of forthcoming appointments, manage any insurance requirements, and basically to guide that person all the way through their journey. And that can be both in the Middle East or worldwide. We also have the wellness sector, which is we have dedicated nutritionists, and they provide lifestyle changing plans for clients with the use of precision medicine, telemonitoring, and continuous motivation. So THB Home Care. So we also offer high quality services that are tailored to patients' needs. And that can be anything from a newborn to an elder citizen, and that is all within the comfort of their own home or the accommodation which they are staying in. We offer experience, knowledge, training, resources, and all of our nurses are licensed within the UAE and also in their home countries. So we're able to provide very safe and knowledgeable nurses to take care of our clients. We have a holistic approach to patient care. So we have access for our clients is 24 hours a day, and that's access to a multidisciplinary team. So that, as we've discussed, it includes registered nurses, registered dietitians and nutritionists, nursing assistants, the health managers, we have general practitioners as well, and physiotherapy. So Other services that we offer within that for home care, we have a dedicated service for palliative care patients, so patients that want to have end-of-life care at home. We offer phlebotomy services for taking laboratory samples at home, and basically anything that you can imagine. We do wound care, we do health coaching, we do elder care, and particularly during this current time of COVID, these services, we've definitely seen a big increase in the requirement, particularly for the elderly, to have those services at home rather than as an outpatient within a hospital facility. So why go for virtual care? Well, as we discussed with COVID, that I think has brought it more to the forefront. Virtual home care has been around for many years, but it generally hasn't been used greatly by people in the homes. People tend to want traditional care where they visit their doctor in the hospital environment or the clinic environment. So for us, virtual care, for some patients, it's extremely difficult to accept a live-in nurse, particularly for elderly clients that have been independent all of their lives, and they find it very hard to accept that their level of independence has declined with age. There's difficulty in transporting to the hospital as well for minor health complaints, and that's certainly been increased during this period of COVID, where it's not only difficult to transfer to the hospital, but it's also, people are asked to avoid using the hospitals and only to use it for emergency care. Other reasons, people live in a large geographical area. So, virtual care means that we can offer that remotely without having to travel over large distances to visit that client. We have, issues with clinical workforce distribution, the logistics associated with traditional home care, of delivering that healthcare professional to the client's home, obviously is quite a task. So with virtual home care, we can do that from the comfort of our control center here in the offices. And as we've already discussed, with the current situation, all of those things have become more important over the past few months. So information technology can address these challenges and enhance the services that we offer in home care. And this is when tele-monitoring really comes into the picture. So what is tele-monitoring? So tele-monitoring is a remote health monitoring or remote patient monitoring using technology to monitor a patient's vital signs, primarily in a home setting. Tele-monitoring is used for chronic disease management, such as hypertension, asthma, heart disease, and lung disease. And when incorporated in the management of chronic diseases, remote monitoring can significantly improve the quality of life for patients. So the benefits of tele-monitoring, it can reduce the complications associated with chronic disease management and give better follow-up and better communication to their primary physicians. Healthcare services without the need of going to the hospital, so the convenience of being within your own home. It has a reduction of patient travel time and generally cost involved in that. Specific populations such as the elderly and chronically ill patients, or people who are self-isolating or in quarantine, it's particularly very important to be able to monitor those patients remotely. Increased patient awareness of health and increased commitment, early detection of symptoms and therefore reduction in mortality rates, assistance in finding adequate medications for patients by constantly monitoring their reaction to medications that are prescribed, earlier evaluation of decline in health status, and reduction in the overall rates of emergency visits to hospitals in general. So our tele-monitoring device, the device that we're using is CE approved, which is a European approval, and it's made by a leading company in Hong Kong. So it uses infrared technology to be able to monitor a patient's vital signs. So it can monitor 13 of these vital signs in total, and that covers hemodynamics to blood gas analysis to respiratory care. So in brief, it monitors the pulse rate, which is very important for detection of any decline with the patient, but also if patients are on medications to regulate their heart rate, we're able to monitor that through the device. Blood pressure is monitored, and as we said earlier, this device is non-invasive. So I'll give you a demonstration shortly of how it's done. But basically the machine is just placed onto the finger like a little peg, and it can read all of these parameters from just your finger. So blood pressure monitoring, which is always very useful, particularly in the Middle East. We have high rates of hypertension, obesity, and diabetes. So to monitor blood pressure is very important. And it can also be extremely useful when patients are prescribed newly for hypertension, and the medications need to be monitored and the dosages monitored according to their blood pressures. It monitors cardiac output, and that's obviously also linked to heart disease as well, and is also useful for hypertensive patients. For the respiratory component, it does the traditional oxygen saturation, which is an SpO2, which is traditionally what you will see in the hospital, where the nurse or the doctor may put the little peg onto your finger. So we're able to monitor the oxygen saturations, and this is very important, particularly with patients with chronic respiratory diseases, and especially if they're on home oxygen at home for conditions such as COPD. It also has a component that also analyzes the blood gases. So we're able to read the pH and the PO2 and the oxygen levels as well. It also registers hemoglobin levels, which we can obviously check, particularly with the elderly that are very prone to anemia. And it also monitors I can never say this one. I'm going to say it short. I can never say this word, so I won't try. But basically, it monitors a parameter that can indicate dehydration and deficiencies or kidney problems. So the package for virtual home care. For us in the Health Bank and THV Home Care, we are offering a package of virtual home care. So that includes all of the services that I've previously discussed. So it includes a health manager. It includes a nutritionist online. So they will do initially a virtual consultation, and then they will do monthly follow-up for that patient. It gives you access to a doctor online and virtual consultations and with monthly follow-ups. We have the nurse triage, so that is twice daily. So the parameters that are read from the device will be analysed from our control centre by a registered nurse, which is overseen by our doctor. And we will relay those results to the client, and also we will do monthly home nursing visits if required. Now, at the moment, those visits in the current climate tend to be virtual home, virtual visits, but it can be a home visit as and when the restrictions are lifted. And then, of course, the tele-monitoring device itself is part of the package. And that is used for the daily monitoring and the 15 vital signs. Also, part of that is that the client themselves can actually see their own readings. So there is an application that is attached to the device, which we do all the setup for the client. They don't have to be IT savvy, which I definitely am not. So we actually go to the home or help them remotely set that up. But they can monitor their own readings as well if they want, and it gives them nice, pretty graphs and things that they can keep. And we send them to them as well. So the health manager, like I say, will be dedicated to that patient, and they tend to be the primary contact as well. If that client then would require any referrals, as an example, we've had 2 recent clients where when they started with the virtual care, one gentleman was already on antihypertensive medications, and after doing his readings over several days, realized that actually his blood pressure was on the lower side. So a referral was made for that gentleman, and actually he was removed from the medications. So that wasn't detected before he had the virtual monitoring. And another example of referrals would be, we had a gentleman that during the course of us taking the vital signs, we realized that there was some abnormalities with his respiratory parameters. So he actually was referred to a pulmonologist, and it turned out he actually had sleep apnea. So it's a very good device to be able to not just manage existing conditions, but also to pick up conditions that maybe the client wasn't aware that they had. So the benefits of the device, you know, it's safe, it's really easy to use. Like I say, I'm not IT savvy in any way, and I manage it very easily. So it's non-invasive because it just sits on the finger. There's no consumables required. You can have multiple clients on one device because each client will have their individual login with their application. So it's very cost effective in that way. And like I've previously said, it can help to detect diseases such as hypertension, anemia, asthma, heart and lung disease. So the device. So I'm not sure whether you guys will be able to see it. I'll try and, oh, you shared the slide. Thanks, Reem. Okay, that makes it much easier. So as you'll see from the screen, on the bottom right, there's a small device, and that literally is in real time. That is the actual size of the device. So it's roughly the length of your index finger, and it sits either on your first or your second finger. So you'll see from the graph on the front, that's just some of the readings that can be taken, which is the PCO2, the PO2, and the SpO2 that's there. It also has the heart rate, and it also has the ECG monitor on the bottom. Thanks, Ray. That's a good job, because I couldn't show it otherwise. So,
Demonstration.
okay, so the device, I'm hoping that you guys can actually see it. So in real time, this is how big it is. So if you can see from my finger, I hope, it literally is the length of my finger. So it's very, very small. Thanks, Albert. It's just one button to turn on, and then it gives you many, many options here. But to take a measurement, it's just up, down, arrows. Ooh, too quick. Okay, and then you have to open the case, which is very easy. Do you want to do it, Reem, maybe?
Which finger?
This one, it's fine. You place onto the finger and just close the device, and then it turns towards what would be the patient. It's very difficult to see, Reem, if we can try and turn maybe. So at the moment, if you can see, there's a green sort of spot in the middle. That's it, just taking the readings. To taking the readings, as long as the client is sitting very still, and sorry, that's because it's above your heart. Sorry, it's very difficult on camera. It's easier in real life. So to get an accurate reading, it takes up to 90 seconds to get an accurate reading. And also, unfortunately, Reem has long, beautiful fingernails, which doesn't help. So ideally, you know, they need to have quite short fingernails in order for the sensor to pick up the readings. So I don't know whether you can see there. It's going to be quite difficult, isn't it?
Maybe we can go closer to the camera. Yeah, here.
Okay. Yeah, that's better. Ian. And that's it. So it basically sits on the client's finger, like I say, for 90 seconds in order to get enough data for it to be analysed. Those results then will be received, like I say, instantly. The client will be able to see that on their application. But those readings then, it will notify the nurse on duty for that day that is monitoring the results for the virtual home care customers. And then they will relay those results direct to the client. And obviously, if there's any abnormalities of any form, we're able to also look in more depth on our screens in the command center, where we can tell whether maybe it was because the client had long fingernails or whether they were moving or it was in the wrong position. So it will tell us whether it is a genuine reason, genuine reading, or if there was some error in the client taking that reading. And then we call them and just guide them through if they need to amend the reading, or we obviously manage if any of those readings are abnormal, and we can discuss it direct with our GPs if we have concerns and refer as appropriate. Have I missed anything, Reen?
I'll just share one of the slides as well.
I think it'd be useful to see the graph forms if we could, because I think that was
the hemodynamics, like how it will appear on the application when they view.
Yeah, perfect. Readings. Yeah, so as Reen was saying, so this is what the client can see on their application, but it's also what the nurse sees as well. So you'll see from the screen in front of you, this is the hemodynamic panel. So it's covering the heart rate, the mean arterial pressure, the diastolic blood pressure, and also the systolic blood pressure. So all of those readings are very, very important for, particularly for heart disease or anybody that has hypertension. Do we have the second one, Reem, with the respiratory? I think there was two.
Yeah, it's in a separate. I'll try to share it later on.
Okay, no problem. So we can always share it later on, or if people want to see more of what's detected. I think we've covered everything, I think. If anybody has any questions, you feel free to ask now.
I don't think there are any questions.
Let's just give people a few minutes.
Okay, there is one question here. You can read it, Emma.
Hi, I'm glad it's somebody anonymous. Okay, so there's a question here. It says, is it safe for the same family to use one device during COVID-19? That's a really good question. So the answer is yes, the same as any medical device, as long as you follow. Do I have to type, or they can? No. Oh, okay. So as long as you follow the proper infection control measures. So the same as any nurse that would be taking your blood pressure in a hospital, they would be cleaning that piece of equipment in between each patient. So it's exactly the same in a home environment. It's only a very, very small device just onto the finger. And part of our service, when we actually onboard the clients, we provide the necessary medical wipes to clean those devices down. And the medical wipes we supply do kill COVID as one of many infections. There's obviously many infections, not just COVID. Wow, now everybody's coming in. Okay, so any of your services operating in Pakistan, I won't read the name out because I'm not sure if you want to be confidential or not. Yes, 100%, please get in touch. We have all of the services now available in Pakistan, so we can get one of the Pakistani team to reach out to you if you would, like more information on the services available. But yes, definitely. Okay, which specific elder care do we provide? Again, I'm not going to read the names. I'm not sure if you guys can see them anyway, but elder care, that's a good question and a very broad question. So from elder care, we provide nursing care, anything from a 1-hour visit up to 24-hour a day care by a registered and licensed nurse. We provide physiotherapy. Again, all of these services are to the home. We don't have a medical facility. Our facility is everybody's home. So we have, like I say, physiotherapy. We have dietetic services. We have wellness services. We do laboratory tests at home, which we find that particularly with the elder population that is very popular, because it's exhausting for any elder to have to get into a vehicle to be transported to a hospital for just a blood test. So we can take those blood tests at home. Generally, most results are available within 2 to 3 hours, and then our health managers relay those results to the elder's primary doctor if it is within one of the hospitals here. So yeah, we offer an array of services for the elderly. Are we allowed to operate this device ourselves? Ooh, okay. I'm assuming, do you mean, do we require a nurse to use the device? I think maybe that's what you mean. I hope I'm answering it correctly. But it's very, very simple. It can be operated by any lay person. You do not require a nurse or any clinician to operate the device at all. And then if there is any issues with troubleshooting, like I say, we are available. From the command center, the nurse is working 24 hours a day, monitoring the readings from the device. So any problems at all, we can talk the client through that. And if need be, we can attend to the home if there's any issue, but very easy to use. We've never, even some of our clients at the moment that are using the virtual home care are in their 80s. And to be honest, I think they're probably better at operating it than I am. So it seems to be quite easy to use. What else have we got here? How often at charge? Okay. How often does the device need to be charged? Okay. Because it's like a mini computer almost, it does use a lot of battery. So what we advise the clients is that you only remove it from charge when you're using it. So yeah, it should be on charge really all the time. And the kits that it comes with, everything's with that. So a bit like when you buy your mobile phone, there'll be a case there, the charging unit, everything. So it needs to be kept on charge when not in use. Can the patient see their previous readings? Absolutely. So within the application, they can view all readings. Also, if they want to request hard copies, we can arrange that as well through the health manager. So they will just tell us that they require it. Some of the clients obviously want the history of the readings so that they can take those to their hospital appointments with their consultants maybe. So yes, we can do that.
I think you missed one in the top. What if several family members have different pre-existing conditions?
Oh yeah, sorry, they're just coming in very slowly. So what if several family members have different pre-existing conditions? Would it be a risk? Again, I'm not sure. You mean an infection risk or a risk to their pre-existing condition? I'll try and answer it. I think from the infection control point of view, I think I've answered that. You know, it just needs to be individually cleaned between each client. So that would be the same if you were in a hospital environment. And there's no risk at all. The only risk with the device is if you keep your finger in for a prolonged period of time. But even then, there is a safety mechanism within the device that alarms to tell you, and then it closes itself off anyway. It's because it uses an infrared I don't know whether you can see, but there's an infrared sensor on the inside, so no risk. Okay, is this device helpful for the monitoring of my nutritional requirements? I think maybe you can answer that, Reem. Reem's actually one of our nutritionist dietitians, so I think you can probably answer that.
Of course, it can help, especially if you have like a hypertension condition. Then we can give you like a diet or tips to improve your hypertension. In case you have hypertension or you are prone to have hypertension, then we can give you like tips with your diet or with your exercise to improve that condition. As well as for heart condition, we have tips for that as well. So yeah, of course, we can help with the nutritional requirements.
Okay, what else have we got here? Does the package include tele or virtual sessions with licensed psychologists? No, unfortunately not, but that is part of, we do provide referrals if that's required, but no, the small device wouldn't help with a psychologist, unfortunately. Can the device be used by more than one? But we've done that one. Calibrate, sorry, that was slightly different. Does it need calibration? Okay, so somebody's asking if it's used by more than one person, will it require calibration? It doesn't require calibration in between each client because you have separate logins. So it's a good question because I actually didn't cover that actually. It's a Bluetooth device. So when we do the setup for you, the device is actually linked with that phone. So basically each family member would require their own mobile phone. So the device will then register which client it is. So there's no mix up at all. You could have 20 people in a household using it as long as there was 20 mobile phones and 20 accounts set up. So the calibration is just done when you first open it brand new. We obviously have to calibrate it. And then it has its own internal calibration, but then it will also prompt you. I think it's every 30 days, but I'd have to check that. I think it's 30 days. But certainly there's an internal calibration and then it prompts you to calibrate. The calibration is very, very simple. It's a small plastic device that is placed instead of where your finger would be, you put the calibration arc and it just takes 30 seconds to do. Can I purchase this device in Pakistan without your home nursing services? Sure. You can, the beauty of this device is that it's virtual. So this can be used by anybody anywhere around the world and still be monitored by a central control center. So the answer is yes. You can buy it standalone package without the home nursing services. We have many different packages available. You know, some of our clients have taken home nursing plus they've taken the device. Other clients, they're pretty fit and healthy, but they have minor health concerns or they're worried about blood pressure, diabetes. They just take the device and the package alone and they monitor that from the home. So we can help with anything, but no, definitely not. You don't need to take nursing with it. It can be standalone. Okay, will this be helpful to keep in offices to monitor employees' vitals? Ooh.
Good idea.
Yes. Yeah, it can be used anywhere. The only thing that would need to be set up is, as I said, you would need to, everybody has mobile phones these days, so it's not like people have to buy them. But yeah, it would just be an individual login. So Bluetooth login every time you check them. But yeah, sure, that can be done. Particularly if companies are looking into occupational health and caring for their staff, it would be great for checking employees, yeah. How many devices will an office of 50 employees require? Ooh, okay. Well, it really depends on how quickly you want to get that done. You know, if you need to get 50 people done at the same time, then you really probably would need, you know, probably 5 minimum in order to get it done at the same time. However, if you're staggering those employees, I don't think many companies would do 50 employees, you know, in one go. You know, maybe you could only have one device, but do different employees' vital signs on different days. Hope that helps. Will the mobile need an application to connect to this, or Bluetooth only? Yeah, like I said previously, it's the customer will have their own application on their mobile phone, and then it connects to the device with Bluetooth. Right, okay, can you monitor our employees round the clock for COVID-19 prevention? Okay. So I'm assuming you mean with the device. The answer, can we monitor your employees round the clock? Yes, we can with our traditional nursing services. Regarding round the clock for employees, the monitoring is intermittent monitoring, okay? So you cannot keep your finger in there, you know, for 10 hours. It's intermittent monitoring. So it depends really on the stability of those employees and how sick they are and what level of care they would require. We have had some inquiries, particularly from construction sites or labour camps where they have high population of employees, but they generally take the device plus the nursing services. Because of the high volume. But yes, we can, and we've had many requests to do that for big staff numbers, yeah. Wow, I thought nobody had asked a question. Where would you?
That's nice.
Would you recommend the device to be used for baseline screening? Ooh, baseline. Okay. It can be used for any screening, basically. I think this is even more than baseline. Generally, as a nurse, baseline would be your basic observations. So it would be your heart rate, your blood pressure, and your oxygen saturation, and your temperature. This does much more than that because it's more in depth with the cardiac monitoring and, excuse me, and also with, I lost my train of thought then, cardiac and respiratory, sorry. So it's more in depth than baseline, far, far more. Oh, and just for clarification, because I've just realized I didn't explain that me and Reem actually house share. So this is why we're sitting next to each other. I apologize. I meant to say at the beginning, because people may worry because of the COVID and social distancing, but we're permanently social distancing. Can they be monitored without this device? Can they be monitored without this device? Can who be monitored? I'm assuming you mean, can patients be monitored without the device? Sure, but it would be traditional monitoring, i.e. a nurse going and taking vital signs and doing it face to face. I'm assuming that's what you meant, linked to the last question.
Do you want to mention the
can
cost?
You go? Somebody was asking about the costs of the services. The best thing for that is to just drop us an email on the Health Bank. If you go to the website, all the details are there, and then we can get one of the health managers to give you a call back. There's many, many options, so I don't really want to go into all of them, you know, now, but yeah, sure, we can help you. There's many different options. We've done that one. Okay, if the patient needs continuous monitoring, can the device be on the finger for longer than 90 seconds? The answer is no. So the device is not intended to be on the finger for any more than 90 seconds. And the maximum it can be is actually up to around 4 or 5 minutes because of the infrared. So this device is not designed to remove the need for continuous monitoring. Continuous monitoring is needed for unstable patients. So that's a different level of care. This device, like we discussed earlier, the reason that this device is great is because traditionally people would go into their local hospital, their GP, if they're back in my country, you'd pop in and get your blood pressure checked, and you know, you'd go as an outpatient to get these vital signs. And unfortunately, as you know, at the moment, that really is not a good idea. So people are avoiding going into hospitals. This can all be done at home. But it's also a great tool for, you know, monitoring chronic conditions, not acute conditions. So it depends on the stability of the patient. I hope that helps. Do you have a contact number to order this in? We do. Somebody's asking about ordering in Pakistan. Again, if you can get in touch.
Tell her I can type.
Oh, you type it, see? I told you I'm not IV savvy. So Reem will just send you the number now, okay, for the Pakistan. Oh, something. We'll try and send it now. I think it's working. Somebody's asking, who will guide me on the medication if I require it, if any? Okay, so again, there's not really one answer to that. We do have GPs, like I say, we have registered GPs here on both for THV home care and for the Health Bank. So we can arrange for a virtual consult with our GP, or we can, with the health managers, we can actually set up those appointments with your preferred consultant in whichever hospital. As you're probably aware, a lot of the hospitals now are also offering virtual consults as well. So yeah, we can help you with that, either in-house with our GP, or we can refer you. Do you have doctors doing home visits as part of your home care services? Yes, we do. Yeah, so there's two parts to that. So our GP does routine visits to our long-term home care clients. So for most of our clients, you know, for instance, one of our clients has been with us for over a year. So, you know, they're reviewed every month by our GP, and that's with myself and a senior nurse. So we do, excuse me, we do an MDT, a multidisciplinary team review of all of our long-term home care clients. So that's one part of it, monitoring of those patients, but also our GP can also come to do a home visit of any form. Like we have customers that call that just want a GP to come out and do an assessment, that's fine. They have the authority and the licensing to be able to prescribe. So we can do both of those services. Oh, there's lots of questions about Pakistan here, which is great. So Reem will answer to that one as well. So the answer for Pakistan is yes, yes, yes. So we'll send you all the details of the contact in Pakistan, and then one of our representatives will get in touch with you, okay?
We have somebody chatting with us. I've been attending, there's a question from Facebook.
Yep.
Because they can't type in Facebook, so we have to send the question here. Regarding psychologists, I've already answered that. I said, oh, I see you just answered that, thank you. Okay, that's it, I think.
Hopefully we've covered everything. We're trying to switch between sort of Facebook and Zoom. So, you know, if we haven't answered anything or you have any further questions, please feel free to reach out. So, like I say, you can go on to, oh, there's two more. Wow.
How can I pay from Pakistan?
How can you pay from Pakistan? Okay, we're very modern as a company. So we offer many forms of payment. So like I say, reach out with your number or contact and we'll get somebody to contact you directly to discuss that. But payment can be made the normal routes. We can do remote via bank transfer, credit cards, or we also have, what's the direct payment with the link? we send a link to the customer and then you can pay online. So it doesn't need to be face to face. I think cash is going out of fashion, I think. So in which countries do we, I think that's it.
One person is saying that, would you please answer the above question if you have time? Any countries, not Pakistan, where you operate? All I'm hearing is Pakistan.
Oh dear, sorry. Who's that? I think, okay. Yeah, we do. So we're in the UAE, about to go into Saudi and Singapore and Pakistan. You asked me not to say that, but it keeps coming up. So yeah, we're in quite a few countries at the moment.
One new message. That's it.
Is there anything you want to add, Reem? Because I feel like I've been talking. You're very welcome to get in touch. I really hope that you've all gained something from this. We're happy to discuss anything, so please get in touch, email, phone calls, WhatsApp, whatever you're comfortable with, and we'll try and help you where we can, okay?